say, hey, look, we're on the front lines of this. We need to be the ones with the right information, getting out there to the patient. So that's kind of why I'm here. Thanks for listening. All right, so just for a little background, in April of this year, a lot of the major health organizations around the world started reporting these cases, seeing this new flu virus. Oh my gosh, what is this? Oh my God, whatever. So they called it H1N1 as the designation. Started calling it swine flu. So then by May, pretty much everybody was starting to freak out about this new flu. Oh, what are we going to do about this swine flu? Nobody's ever seen it before. So actually in Egypt, the government, against recommendations from the World Health Organization, all the other organizations, they were saying, look, this isn't coming from pigs, it has nothing to do with this. Egypt ordered the slaughter of all of the pigs within its borders. That totaled about 300,000 pigs. So now these are the streets of Cairo as of a few days ago. Previously, the pigs were in charge of cleaning up all the trash in the streets. So now these goats aren't really able to handle it, and trash is piling up. It's causing huge health problems, in itself. So obviously, this was kind of a major failure on the part of the government, but you can kind of see what happens when people get like fear overtakes us, and we don't really have all the information before we make decisions. So as healthcare providers and working in healthcare, we are not only have the obligation, but we have the fortunate opportunity to be in a position to kind of help people with this. So we're responsible for having all the accurate information, so I can help you with that today, but getting the information to the public, but most of all, staying calm so we don't have situations like this. So this is kind of where we are right now. You can see it's kind of hard to tell, maybe you can't read in the back, but brown means widespread flu. So pretty much we have lots of cases reported. This is a chart. This year is red. Previous years are blue and green. So you can kind of see over here, this is normal flu season. These are percentages of office visits that are due to an influenza-like illness. Whether it's confirmed flu or not, we don't really know. But this is normal flu season, the spike we get. We're over here, this red, we're seeing a huge number of influenza-like cases in the non-standard flu season. Normally the flu's in the winter months, but now here we are in September and we're still seeing a lot of this flu, so what's going on? This can put a potential burden on our system. We're getting all these patients with this flu-like illness. What do we do with them? Our regular patients can't get in because they're filling up all the spots. The CDC is reporting that about 5 to 15% of outpatient visits right now are due to influenza or influenza-like illness. I don't know what you guys are seeing at your clinics, but you can kind of see how this is becoming a problem and could potentially be more of a problem. So what can we do about this? Remember that not everyone needs to be treated, so maybe we can encourage people to go the right route so we don't overburden the system. So a few things to realize. This year there are 2 flu viruses, or roughly 2, that they think might go around. There's the normal seasonal flu, which will probably come normal seasonal flu time. There's already a vaccine for that out now. Then there's this H1N1, which is totally separate. Since there are 2 different viruses, there are going to be 2 different vaccines. A lot of people in clinic have questions about this. The second H1N1 vaccine isn't available yet, but it should be in October and November. So, also important to remember, this swine flu, it's new, but it's not necessarily worse than any other flu. So like I said, there are going to be 2 vaccines available. The vaccines are recommended really for anyone who wants to protect themselves against the flu. You'll need both of them to be fully protected against both viruses. Now, like I said, they're recommended for anyone who wants protection, but especially for those at high risk of getting complications if they were to get the flu naturally. So these high-risk groups basically include the very young and the very old, pregnant women, people with certain chronic health conditions, lung problems, sickle cell. You can read up on a specific list of those if you need to. But also people who live in nursing homes or long-term care facilities, or people who take care of these kind of people. And that's all of us. So we're at risk seeing patients every day. We're at risk of contracting it ourselves. So important stuff to remember, it's no more virulent than any other flu, and not everyone needs to be treated. Okay, so a lot of people, the media is just fueling this hysteria. Oh my gosh, people are dying of this. People die, unfortunately, of the flu and many other causes all the time. So really the problem comes down to, the response you get from the flu is from your body's immune reaction. Young people have usually strong immune systems, so that produces a robust cytokine response. You feel worse, so you get worse symptoms. Now the actual deaths is complicated, and they're a really, really low percent of cases. So let's look at the numbers. As of a couple days ago, there are 991 reported confirmed cases of H1N1 in Louisiana. Now, these are only tested positives by laboratory PCR testing. Now, they're not recommending that everyone get this testing because it's expensive, it's time-consuming, it's really unnecessary, and doesn't affect their treatment. So really, the CDC estimates that from these numbers, actually 60,000 people probably have H1N1 in Louisiana right now. And there have only been 8 deaths. So, as you can see, as a 0.013% mortality. So, in reality, it's not so bad. So, it doesn't seem so bad. Why is there all this hype? Now, just looking back historically, it's the first pandemic, meaning global outbreak of disease, new flu, in 40 years. So historically, it's a little important, I guess. And like I mentioned before, we're having an earlier start than most normal winter flu seasons. And we're still kind of learning about its transmission and behavior. But, like I said, it doesn't seem to be any worse than any regular seasonal flu. So, okay, it's only killing, a few people. What's the problem? Obviously, it still causes a pretty, crummy viral illness. Nobody wants to get sick with the flu. What it comes down to is lost work time, problems for the individual, problems for the employer, you're short on staff, all this stuff. Then there's this incentive, you want to go to work so you get paid, but then if you go to work, you're putting other people at risk. Also, there are childcare issues. If you don't have anybody else to take care of your kid, you might send them to school and they might be a little too sick to go to school. So, there are a lot of problems with that.